If you have lumps on your fingers because you have hand arthritis, then you probably have noticed that they're getting thicker and maybe more painful, more swollen over time. And you're probably wondering if they'll ever go away, if you can do anything to make them go away and become less painful so that you can use your hands and know that you're not letting your hand arthritis get worse. Well, I'm going to tell you a little bit about what they're called and how they work and give you an expectation of what to see as time goes on so that you can know if your hand arthritis is getting better or worse. These lumps that occur at the last joint of your finger and the second joint of your fingers, so it would be here and here, and it can happen in any of these four fingers. They're called Heberdine's nodes at the tip right here, and then Bouchard's nodes. They're just the medical terms. But these nodes, these thickenings at the joint, happen because of an increased pressure, and the bone reacting to that pressure, it's thickening to protect itself. Very much like a callus happens on your hand because you're getting a lot of pressure in an area. Your skin will thicken to protect itself, where your bones are thickening here in an effort to protect themselves because of the pressure buildup in the joints. It's not an age-related problem. It's not a disease that you catch. It's a pressure-related problem that happens over time. And if you can take that pressure away, then you can help out your hand arthritis. Now, my experience as a specialist physical therapist is that these lumps won't go away on their own, but you can do treatment to get your hands to feel better so that you can use them in your everyday activities without your hand arthritis getting worse. The lumps themselves, though, will probably always be there unless you go through some surgical procedure to have them removed or to have a joint replaced. Surgeons will do these procedures. If you talk to a hand surgeon, they're probably going to look at the possibility of replacing a finger joint. There are some cases where they'll shave off the bone, but the risk of doing that is high in that you'll still be in pain afterwards if they just shave off the bone. The joint replacement could relieve pain, but you usually will lose strength in the process that you may never gain. But it might be worth it for you to do that. But before you go to surgical solutions, here's what I want you to think about. There's a muscle imbalance in your hand where the palm muscles that can influence the way your fingers move, those palm muscles get weak. And then the muscles that bend your fingertips, they actually go all the way down here. Those become dominant when the palm muscles become weak. So when those tendons, the things that connect the muscles to the bones, they run through your palm into your fingers and they bend these joints out here where you get the lumps. When the muscles get dominant there, that's how you're building up all that excessive pressure because the tendons are pulling the joints together. And if they're holding that pressure there constantly over months and years, then that's when your bone starts to adapt, like the calluses that I described, and it begins to thicken. And the thicker that it gets, the more it can impede motion at your finger joint, and then it begins to look like the big lumps that you see in very severely arthritic hands. They can become painful, red, and swollen when they're actively inflamed, but they can calm down if you take those pressures off, and they can even become functional. They can work just fine if you can restore the balance between the palm muscle strength and the forearm muscle strength, the ones that send the tendons to the fingers. And that to me is a better situation if you can avoid surgery, because that opens the door for potential problems, for infections, failed surgeries. If you can avoid surgery altogether, then that would be beneficial in your overall health. But if you are in a situation where the pain is high and your ability to use your hand is pretty low and surgery is looking like it's the right option, just understand that you will still have the muscle imbalance unless you actively fix it to get better palm strength, which I talk about in a lot of videos. You have to fix that palm strength regardless whether you have surgery or not. The surgery isn't going to fix the root muscle imbalance problem that leaves you with the development of these nodes. So it's very possible that if you replace this joint, for example, and you don't have a big lump in this joint out here, that you can eventually develop a lump out here or in other fingers, even though you already had a surgery for one. You've got so many joints here that you can potentially develop lumps at because of that root muscle imbalance. So fixing one surgically doesn't fix it for good. You have the root problem there that needs to be addressed for the sake of the rest of your joints in your fingers and in both hands. Fixing the muscle imbalance between the palm and these muscles is the long-term plan. It can take a while, but in the short term, I want to show you what I use for hand arthritis relief right here and it costs under $1. Go check it out.